Welcome to the PT on Ice Daily Show. My name is Dr. Jeff Musgrave, Doctor of Physical Therapy, proudly serving the older adult division. I came across an interesting study I wanted to share with you all regarding some strategies to help improve results for cancer survivors. So I think we all can appreciate that older adults in general are struggling with exercise dosage, of a lack of activity, a lack of quality strength training, but a population that I think we don't think about specifically, which is a big proportion of our older adults, are those that have survived cancer. And they have a special amount of loss of strength and increase in vulnerability. So, what I'm going to be sharing with you are three keys for better results for cancer survivors. This study is called the E-Proof trial. 75 older adults, 65 and older, post-cancer treatment. It was 12 weeks fully online. So our intervention group is getting progressive resistance training, protein coaching. Our control group is getting general health, education, and stretching. Okay, so pretty wildly different interventions here. There is a general health component here, but no specific guidance on strength training. The only physical intervention is stretching. So when we look at the intervention group a little more closely, the nutrition target for these older adults post-cancer are 0.8 grams per kilogram of body weight per day. They also were given a range based on specific factors to each individual to consume 1,600 to 26 kilocalories a day of whole foods. They got one-on-one coaching every 2 weeks, and this was all completed online. So what they did with exercise intervention was full body resistance training 2 to 3 times a week. They were getting coached weeks 1 through 6. And then the back half of the study, they were left to self-progress, which is kind of interesting when you look at the resistance and the guidance they were given for their exercise intervention. So they were given full body movements 2 to 3 times a week, but their resistance training is what is really interesting here. So in the name of safety, they started these older adults at an RPE of 2 to 4, which is very light resistance in sets of 12 to 15. So that's what they did for the first 3 weeks. The next 3 weeks, they moved up and did an RPE of 4 to 6. And then the next 3 weeks, 5 to 9. And then the final 3 weeks, they finally hit 7 to 9, which is hard on the RPE scale. They were using reps in reserve. And I think when we look at this arc for training, we've only got 3 weeks that we're at proper intensity to build strength. And we're still in rep ranges that are going to promote endurance, not strength. We know by and large, if we're going to move the needle for our older adults, endurance is not usually the focus for most. Their biggest deficits are typically in strength, and we're going to move the needle on their function better if we focus on strength. We want to play nice and intentionally underdose, but when we're looking at this study, of the 12 weeks, the 3 weeks that were properly dosed for strength training on intensity still were not in proper rep ranges to help. So just out the gate, looking at this exercise intervention group, it's too light. It's too light and it's the wrong rep ranges to build strength. Now, this is not throwing off on researchers. It's really hard to design these, get these through the IRB for approval. So I get it. Like, safety is always a factor, and we want safety to be a factor for our older adults, but we're clearly missing the mark right out of the gate. So interesting, when we get to the results, the adherence and retention were excellent. We had 87% adherence rates, 83% retention. Both groups improved, and there was no significant difference between someone getting basic health coaching and stretching and exercise. So I think this is really interesting. I think a cool thing to take away from this is the viability of online training with older adults, which is cool because they did improve their function. They did improve physical outcomes. The sad part is, if our dosage is not correct, we will not move the needle. We just won't do it. We have to be nerds about our intensity and our rep schemes. We could be doing all the right movements at all the right frequency, all the right duration. But if we miss the key factor of the intensity, we miss most of the benefits. And that's really my takeaway from this, looking at this study. Our keys for improving, like they did improve, right? We want to do progressive strength training. We can start light and intentionally underdose, but we can't stay there. So number one, progressive strength training must hit intensity. The second piece, protein and total fuel consumption. It is very much within our scope as rehab providers to give basic nutritional advice. Promote whole foods, right? Whole foods, hitting protein, hitting basic macros, teaching our patients what is a protein, what are viable sources of it that are affordable, that are effective, making sure people are eating enough. We know that satiety decreases. We know that protein absorption decreases as we age. So we know we actually need to be eating more and proportionally more protein of those meals if we're actually going to get someone stronger. And then the last piece is consistency. We have got to build their self-efficacy. I think this program was successful in the fact that they had almost a 90% adherence rate. The problem is we didn't see changes with the progressive resistance training program like we would expect. But when we look at the dosage, it wasn't there. So we've got to remember the dose makes a poison for this population and every population. I think what would be interesting is if they kept this study and continued to drop the rep range and increase the intensity and keep them at that hard intensity and drop the reps so that they could be using more resistance. I think if we saw that continue with the nutrition across another 3 to 6 weeks, right? I don't know, just assuming here, but based on just the principles of strength training, what we know about nutrition in older adults, I bet we would see a huge difference between these two groups. Now, that's just my own opinion, right? I'm not doing the research study, but I think if we continue that for another 3 to 6 weeks at the proper intensity, we would see these older adults post-cancer crush their strength training goals and their functional outcomes, because we see this in the population. When we're looking at these studies, a lot of them are not held back from participating in studies because they have a history of cancer as long as they're functional at the time. So those are my big takeaways. Progressive strength training, we've got to hit intensity. Protein and fueling, crucial for this population. Total amount of intake and proportionally how much protein are we getting in. Promoting whole foods, awesome. The more we can get it, the better. We may have to shortchange that with some protein drinks or things that don't fill up our older adults' tummies so quickly. And then consistency. We've got to be consistent. Consistency and intensity are the key. The missing factor in this study truly was intensity. Team, I would love to hear from you. Any takeaways, thoughts on this study? I hope you have a wonderful rest of the day. We'll see you again on the next episode of PT on Ice, or if you're listening on the Older Adult Podcast.